Hello, everyone. My name is Adeniran. I'm a consultant gynecologist, and I want you to please permit me to share some few points with us pertaining to three major things that are quite related. I will be discussing about child spacing, family planning, and because these two terms are related to contraceptive, I'm going to be sharing few things about contraceptives also. So that means we are discussing about child spacing, family planning, and contraceptive. Now, in a simple term, child spacing is when a woman or we say a couple decides to space their children. They give enough time between the birth of their children, maybe for any reason, medical reason, social reason, financial reason, or even for emotional reasons, we can decide to space our children. That means intentionally we have decided to have the next child at the time we actually want. Now, that means we are not getting pregnant unprepared. That means we are not having another child unintended. That's what child spacing is. And it means the time or the interval between the birth of one child and pregnancy of the next child. So that's child spacing. The best is actually to have about 2 to 3 years between our children in order to afford them the opportunity of good bonding and developmental tasks that are ahead of them, especially in this early stage. And of course, the benefit to the mother also include things like it makes her recover completely from the past pregnancy, and she's able to do some other things for her own personal life, like being useful in the society, mentally being stable. Even within the family, the woman is healthy and is available for the kids. So these are some of the few benefits of appropriate child spacing, which I've said it should be about 2 to 3 years between the birth of one child and getting pregnant for another child. Now, because we want to space our children and because we want to delay pregnancy, we don't want to have unintended pregnancy or unplanned pregnancy, that should not stop us from having sexual intimacy with our partners. So because of this, it is very important to know what we can do despite the fact that we are going to be having sexual intimacy. This will take us to the issue of contraceptive. Now, before I leave family planning, we have a lot of advantages in planning our family. Maybe I've mentioned few of them, but other ones, like simple example of some conditions, you don't have a choice. You just have to determine the number of children you are going to have. And at what point in time are you going to have these children? Take for example, you have a sickle cell patient. Your wife is a sickler and you are not ready to plan your family. So that means you're already on a suicide mission. Another example is a woman who is known to always have a turbulent pregnancy, maybe in the past. So that means you don't have a choice than to limit the number of children you are going to have, or else you are on a suicide mission. Another example is like someone that has been giving birth to abnormal babies. One way or the other, you just have to take your time, prepare your body, or you have some medical conditions, before you have another pregnancy. So you don't just have sex when you know that you can actually get pregnant. Now, the last part of this discussion is contraceptives. A lot of people feel they can't use contraceptive because they have this myth about it. They believe contraceptives are abortifacient. That means they believe they are abortion methods. No, they are not. No, they are not even related at all. So that's what I'm going to say about that. They are not related. So because of this, they are just like drugs. You are having a headache, you want to take paracetamol. So it's just like that. You want to have sex, you don't want to get pregnant now. Take some measures in order to avoid pregnancy. That's contraceptive. So now, one of the things we have problems with is the fact that people believe they can decide based on their friends' opinion or on the society's opinion about a particular method of contraceptive. This is wrong. Go to a nearby recognized health center, let them discuss all the options available to you. Sincerely, I'm very sure you will be able to pick a particular option that will be suitable for you and will have minimal or no side effect to you. You can't assume your friend, Sister Miriam, had a particular side effect and you are not going to have. Don't forget that the risk of dying with each pregnancy today in Nigeria is about 1 in ratio 12. So what I'm saying is that out of 12 pregnant women, one of them will end up dying. So because of this and some other reasons that time will not permit us to mention, I want us to understand these three terms: child spacing, family planning, and contraceptive. Contraceptive, which is meant for you to achieve your family planning, and your family planning will be done by you spacing your children. Thank you very much. It has been me, Dr. Adeniran, your consultant obstetrician and gynecologist.